Welcome, everyone. Thank you for being here. My name is Kemi Carter, and I am one of your presenters today. I am a professor at the University of Chicago Pritzker School of Medicine, and I'm going to hand it off to my co-presenters to introduce themselves really quickly before we jump into this session.
Hi, everyone. I'm Luann Lawson. I'm at Virginia Commonwealth University School of Medicine, and I'm the Senior Associate Dean for Medical Education and Student Affairs.
Hi, everyone. I'm Jamie Jordan. I'm the Vice Chair for Faculty Development at Oregon Health and Science University.
And I am Jennifer Carey. I'm from UMass Chan Medical School, and I am the Division Director for Undergraduate Medical Education.
Thank you all. It's wonderful to have you all here. We're going to be talking about the fact that learners are changing, and we are going to be talking about how we as medical education leaders can adapt. And what you'll appreciate from this talk is that although our areas of expertise are in undergraduate medical education, I'm the Dean for Admissions at Pritzker, and you heard the other co-presenters introduce themselves. A lot of this is going to be transferable to graduate medical education as well. So I do believe we have some GME educators in the room, and I hope that you'll find value in this talk, in this session. We have no disclosures, and here are the objectives. Just very briefly, by the end of this session, I hope that you'll be able to have explored ways to create flexible teaching strategies that foster self-directed learning and critical thinking, discuss how to develop learning environments that do balance wellness with maintaining our rigorous training standards, and then finally learn to incorporate technology-driven methods that ensure learner engagement, high-quality education, and patient care. This is the plan for our session today for the next 50 minutes or so. We are going to reflect on the evolution of education, where we've been and where we are, and some of the emerging challenges that lay ahead. And then our focus will shift to talking about the learners themselves, and then talking about the faculty and how we can support our faculty in adapting to these changes. And then finally, hopefully we'll have you all participate in applying these concepts that we're going to present today, okay? All right, so undergraduate medical education, past, present, and future. I think we can all agree that the goals of education, actually, many of them can be debated. Uh, like for instance, should we be training medical students to be generalists, to have a broad base of knowledge, or should we be differentiating them earlier to become competent specialists? But I think we can all agree, and there is consensus around these three goals: knowledge acquisition of bodily structure and function, understanding of dysfunction throughout the life cycle, and teaching our learners to position the patient within the context of a diagnosis, right? So I don't think there's much debate about that. But what meeting the goals of medical education does require is this complex interaction between capable and motivated learners, a suitable curriculum, skilled educators, and a learning environment and practice environment that centers the patient and delivers expert care. And so we can talk about how we have met these goals throughout history, starting with the formative phase, first 70 years of the 20th century. This focused mostly on lectures, didactic lectures, and this persisted for a while. And I think many of us are old enough to actually have learned from this style of teaching. It focused on memorization. And emphasizing more than anything else the scientific basis of medicine before we move into the performative phase, where we have the introduction of problem-based learning, and then the focus shifts from more memorization to teaching our students how to retrieve data, how to integrate it, how to synthesize it. At the start of the 21st century, we continued that shift towards data retrieval, integration, and synthesis, but now we start to appreciate that education really should include instruction on health system improvement. And so where are we now? There is consensus that instruction of our learners should include the full spectrum of healthcare, of course, within the context in which our learners will practice. So that really does mean balancing teaching them how to deliver expert individualized care, prioritize patient autonomy, but balancing that with understanding the social structures and the functions that help sustain and promote population health, and how to leverage technology in helping them do that. Okay, so I mentioned before that it's this complex interaction between these four factors that really define a medical education, right? Capable learners, skilled educators, suitable curriculum, and a learning and practice environment that centers the patient. But with every decade, there actually comes a call to change medical education drastically. For every decade, there has been a call, right? And so when you think about how these four things have changed, you can understand that with regards to learners, although um, there has been a call to operationalize holistic review in our selection committees, and I would say that most places embrace that. Little has changed with regards to who has access to a medical education, so we have to appreciate that. With regards to educators, there's some barrier between um, or barrier to changing the behaviors of large cohorts of educators or faculty. But some effort has been placed on doing that historically. With regard to the learning environment and practice environment, very little we know from the literature has been invested in actually changing that because it's a gargantuan task. And so by default, when these calls for changing medical education have happened, it falls by default onto the curriculum. And what's interesting is that we can't really measure the impact very well. So although curricula have changed dramatically over decades, it's really hard to understand the true impact. So does shortening the preclinical years actually make better doctors? We actually don't know that for sure yet. Um, but um, but we have to appreciate that there are other factors that we can dedicate time and effort to, not just the curriculum, when we need to change medical education or have it evolve. Okay, so the present learner. What do we know about the present learner? We know from from examining the literature that if you look at an exceptional, excellent learner who becomes an exceptional, excellent clinician, there are four dominant themes that emerge when we examine those people, okay? So core philosophy, it includes passion for patient care that persists, intrinsic motivation, but also humility and resilience. And we know that humble, resilient learners just deal with change better. They deal with uncertainty better. And these emerging challenges that include technological transformation, it really does require humility and resilience. And so we have to think about, like, how are we operationalizing that to look for that in our learners? Deliberative activities. Students who engage with reflective clinical practice, like actually on their own, reflecting on clinical practice to refine their skills. Students and learners who engage in scholarship tend to just continue to get better and better and better. So we all value high performance in our learners, and as you can imagine, this is in the form of high cognitive ability, great clinical skills, but also adaptability. So there is an emerging curricular priority to actually train our students to be able to leverage AI, to be able to deal with humankind's continued shift to being more of an information-based internet society that in some ways is like partially informed. And so the curricular priority is teaching our learners presently to be able to capture and curate information, to apply their knowledge with judgment in the setting of uncertainty, and to understand probabilities and be okay with that, to understand probabilities and apply their probabilities that they understand meaningfully. And then finally, interpersonal skills, as we can all agree on, I think, and embrace. This is what is going to separate us from machines. So empathy and compassion, and really making as a part of the explicit learning environment, or really fostering our learners' ability to remain connected to the humanitarian values that drew them to medicine in the first place. So these are the four emerging dominant themes that characterize excellent learners who become excellent clinicians. Okay, so what do they expect, and how has that changed? I think there are a lot of things. I think as educators, we talk a lot about the learner's expectations and whether or not we can meet them or not, right? Interestingly enough, from the literature, learners' expectations for their educators have not changed. over decades have not changed at all. What they want is effective teaching, of course, right? They need intense role modeling, and they need to be able to identify with those role models. And although these may not be factors that we pay a lot of attention to, this really, again, has not changed over decades. Now, their expectations for curricula and their learning environment has shifted over the decades. They want integrated and efficient curricula. They want small group learning. They want opportunities for repetition of concepts and hands-on learning. And as you all probably appreciate, they want workplace support. Like, this is something that our learners are now advocating for more, and we're going to talk about that. The last thing I want to say about this slide is that, interestingly enough, a lot of these factors are informal, right? So they're not a part of what we do in the curriculum. They're not a part of the formal learning environment. They are informal, but yet what we believe is that the informal pieces are the most impactful. And so we have to consider whether or not we are going to take some of these informal factors and incorporate them more explicitly into the learning experiences of our learners, our students, and our residents. Okay, I'm going to hand it off to Luann.
All right, so as we're thinking about how to adapt the learning environment, and really I'm going to focus on the learner focus challenges and strategies. If we look, what we know about our medical students is when they begin medical school, they look very much like their age associated peers. They have similar or higher levels of mental well-being, mental health. They're consistent in terms of depression, burnout. But what we know is that when they start medical school, those things begin to change. That there's a higher rate of depression, burnout, and these are many of the challenges that we know are fraught in medicine currently. The stressors, particularly if you look at the learners, the academic challenges are really the beginning of what sort of is the focus of that in early medical school. I think for many of us, we've noticed generational challenges. This has gone on for generations and generations before us. If there's recently, I was at a talk when somebody had shown a book from the 1800s, which talked about the generation of physicians following them was so much worse, and they weren't willing to work as hard, and they weren't willing to do all of the things expected of them. So this is not new to us in any way. But I do think that COVID has added a pretty significant challenge for us in terms of people and their development of skills, how they've learned to navigate complex social interactions, and what at least we are seeing is a group of students who may not have the preparedness in some of those aspects that most of us navigated throughout high school and college. And there's some things that are challenging, and then you layer that with the stress of medical school, and it begins to become a significant stressor for them. And so I think that's one of the things that we need to think about is what does wellness look like? And it is not the absence of stress, it's the presence of systems that support us in meeting it with skill, strength, and safety. And really thinking about how do we design a system? How do we as educators move beyond that sort of notion of we're not going to change, we're firmly entrenched, it has to be the way that we did it, and really begin to think about how we can actually create a learning environment that still holds people to the rigor and the expectations of medical school. We are granted, I think, a very special sort of significance of being able to take care of patients at their worst moments. And there's stress inherent to that. We deal with patients who are dying, going through incredible illnesses, and so there's no way to take away that stress. But there are also things that we can do to make the human condition of our learners better, whether that's medical students, residents, or whether that's us in general as faculty. And so we know that burnout is prevalent. And we know that we have to be able to support students in order to maintain this rigor. And ultimately, if we can create those systems, we know we have improved outcomes, not only for our learners in terms of their satisfaction with that environment, but we also know that if you look at practicing physicians, it directly translates into improved patient care outcomes for those in which we serve. And so we have to really think about how do we balance these, because we also deal at times with learners who like Wellness means a day off. And it may, but it may not. And so, what are some of the things that we can really do? And again, thinking about this so that it's not mutually exclusive. We can have high expectations of our learners, and we also can have those high expectations. If we pair them with supportive systems, we actually have deeper learning. We have improved professional identity formation, and we help develop those skills for resilience so that when people are faced with peaks of stress and crisis, that they're able to move beyond that and are able to navigate that. Um, Simultaneously, we actually get horrible outcomes when we provide high support and low rigor. That is not where we need to think about moving our learner. But how do we balance, how do we create environments that balance physical and mental needs while we are in the pursuit of excellence? And how do we communicate those expectations to our learners? I think for many of us who deal with undergraduate medical students, people saw some of this stress and crisis in the midst of step one going pass fail. Many of our learners thought, well, that means that this is going to be easier. It was not easier, and actually, national pass rates for that dropped pretty significantly in that time because it's hard to adjust expectations within that. So I think for us, thinking about how do we move forward, wellness also means very different things to different individuals. And so if we think about you'll see different models for this. This is one that we use at our institution, but you'll find various domains of wellness and well-being and what that actually looks like. And it includes everything from environmental and emotional to actually thinking about your professional and financial components of that. And different individual learners are going to value, just as we as different faculty are going to value different aspects of this in different ratios. And how do we think about that? But when we're thinking about that system of well-being, how do we set up a system that touches in these various components so that learners have some autonomy in how they are going to choose what it is that's important to them and how they navigate them? When we begin to look at well-being programs and think about what actually makes them successful, there are some things that come out in the literature. We talk about formal programming, things that have dedicated resources to them with dedicated leadership and infrastructure and financial components of this in general are much more successful, that becomes a central hub for these resources. And also recognizing that mental health care, I think, a decade or two ago, we thought about that as being the prime focus of it. But for many other, I think now as we're moving away from that, how do we associate that so that people have access to those resources when they need them, but it's not the sole component of it? And they need to be able to navigate before. I think we've done a great job over the past decade of trying to normalize those, being able to improve access to those for our learners. And probably the piece that many of us are missing in our wellness programs is actually the robust evaluation portion of it. How do we know that we are being successful? And this is really moving beyond what the learner thinks about an individual component of it and really looking at, does it make an impact on that? Does it improve our outcomes? For our preclinical learners, does this improve how they're progressing through the curriculum? And are we able to support them effectively? If you look at the literature, though, I think the tricky part of this is you find very mixed literature in this. You'll find that programs that are required, if you have a mandatory lecture on nutrition, this can be met with anything from disdain to sort of maybe boycotting those sessions because people have such a strong visceral reaction to it. So I think in the very beginning, we probably all put some of these mandatory sessions in, and learners revolted. They said, this is not helpful to us. If you couple some of that, though, in a voluntary setting that really meets some of the individual needs, you will see very different results related to that. So how do we build those comprehensive programs? And I think part of this is really the opportunity for us to partner with our learners. They know what it is that they will be able to support them, can at least give us some ideas of what those balances look like. At least for our institution and for me personally, probably the number one mistake that we have made is the way in which we schedule some of these events. How many of you all have seen a wellness session that's put in like 2 days before a major exam or had that experience related? Like, there is no worse way to get buy-in than actually create a schedule that doesn't really think about what it is that the learners need at that point in time, getting feedback from them. Also, I recognize in my position that no one is ever, there are never 100% of individuals who are happy at any given point in time. So how do you try to get that feedback, make meaning of that? And these might be things like, do they need study days? Do you incorporate a 3-day weekend for a wellness day? Because having a wellness day in the middle of the week might not necessarily be that helpful to them. At least through my experience in medical school, my husband was a year ahead of me in medical school. We got married in the midst of medical school a week after I took step one. It never crossed my mind to have a discussion with a dean or a student affairs or anyone else about how to navigate this. We just navigated it, and it worked out okay. We're still married, so there's the good news. Um, but, I think our learners are in a different place now, and they recognize that we have probably opportunities to balance life better than what we did previously. And how can we make more flexible policies, whether that's thinking about absence policies? How do we navigate um, students being able to go to their best friend's wedding? I recently had a student ask me, why do you only value death? Why is it only that funerals are excused absences, but you don't value life enough? I can't go to the christening of, my niece, or I can't do this. And so I think it's really an opportunity for us to think about, how do we balance this? And I recognize that tracking some of these things are incredibly difficult as well. If you look at individual level interventions, if you look at some of the business literature, there are things, and I think we'll hear about this a little bit more tomorrow with our plenary session, but thinking about how do we help people, not only do we think about these very structured approaches, but how can we help actually value creativity and help students maintain that sort of balance of who they were before medical school? How can we incorporate some of that creativity to help us improve our medical education programs? Thinking about managing the environment, we can't make stress to go away, but how do we help students really think about how they can balance that? How they can, if there are things about more flexible leave of absence policies, thinking about when they have these crises within their personal lives. I know we've all dealt with learners, whether it's residents or otherwise, who that they have a family member who's been in a tragic accident, and there probably should be more lenient policies that help learners step away more effectively. And how do we help students understand what those things look like, as opposed to some of the challenges where we have students who are used to being in the top 10% of their class. And we know by virtue of being a medical student that those people now, 90% of people are going to not be in that group of students, just by the numbers. 50% of people are going to be in the bottom half of that class. So much of their identity is tied to success, and that feels like they're not being successful when they have to step away. We are beginning to learn how to use technology with mental health apps. Many universities and institutions are going to this, whether it's our institution uses Timely Care, and they can connect with people from different cultural backgrounds to really think about how to connect on an on-demand need, that they're having a crisis now, that they can be able to adapt, communicate with someone who maybe understands more of their geographic location, their cultural backgrounds, and help them navigate more effectively. And so I think these are opportunities we will continue to learn and engage from our learners. This is a great opportunity as we're thinking about how AI gets incorporated into this. Also, with the challenge, though, in recognizing that there have been some studies that have shown that virtual learning is certainly as effective and maybe reduces the stress. I think for many of us, we've probably seen that we also are at a point in time where we have probably the greatest disconnection from each other. And especially in a world that's constantly changing, that connectivity part is so incredibly important. And so we're going to need, I don't have the answers in this, but I think we're going to need to give really intentional thought as to how do we balance the technological advances that can probably make delivery of things easier, as well as coupling that with the we need to be together and make meaningful times of that. And so, whether it's utilizing app resources or thinking about scheduling so that we're intentional of when we bring to get people together and when we disperse them, that these are things that we can continue to consider as we move forward within the education. And I'll turn it over to Jamie.
All right, so now we're going to shift gears slightly and just talk about faculty development strategies to really meet the needs of today's learners. And what I'm hoping here is just highlight 10 different ideas, both in terms of content and also process, that you can hopefully take back to your shop and maybe give it a shot. All right, so the first one is just going to be faculty development on generational differences, right? Having some insight and some understanding of the major influences of our own generation and also the generation of our learners can be really helpful in terms of thinking about how they might view work, how they might view education. What are their motivations? What are their values? This also will provide a nice opportunity for faculty to actually reflect on their own experiences and their biases and hopefully acknowledge these. If you're looking for some resources, Medit Portal has some good examples, and then Jean Twangey's book, Generations, is fantastic, so I definitely recommend it. All right, the second one is it's going to be really important for faculty to be well versed in topics that are important to our learners, whether they're actually giving instruction on this type of topic or not, just to be able to have meaningful discussions, conversations, to be able to relate to our learners and actually gain their trust. So providing some faculty development on topics that they care about, like inclusion and belonging, social responsibility, wellness and mental health, time management, life skills. These will all be very beneficial. All right, feedback. Now, feedback is nothing new. This is an important skill for faculty that we should all have, and there's not a whole lot new there. Other than that, this is really important for today's learners in that they expect it, right? And they really rely on this as part of their development. And I think some key aspects to focus on are thinking about frequency and transparency. And also with our feedback, focusing on process and effort to really promote that growth mindset. The other thing that today's learners really value is sort of a mutual approach to learning. So not only equipping our faculty with the ability to give high quality feedback, but also the ability to solicit feedback from their learners and actually model receiving it. All right, so number 4, faculty development to help faculty optimize their content for today's learners. So we talked a little bit about today's learners' preferences, right? So trying to help support our faculty and making sure that their instruction is aligned with their objectives, helping them find ways to chunk information in meaningful and highly engaging ways, focusing on quality over quantity, right? Today's learner is really into efficiency in teaching and learning, and faculty need to really make every minute count and really hone in on what's essential. They can also think, we talked about like being able to estimate student workload. So having the ability to do that and actually apply that when they're making curricular schedules. And then figuring out ways to support them in combining a mix of both in-person, interactive, highly engaging educational strategies and also online supplementation. And then teaching them facilitation methods so that they can incorporate things like peer teaching, micro teaching into their instruction. All right, so number 5, faculty development and coaching. So we all know that coaching is becoming more prevalent these days. And it's different from what faculty might be used to doing in terms of advising or mentoring, in that it's more learner-centric, it's more goal-oriented. And so really helping our faculty be able to be successful coaches, how they can use coaching in undergraduate medical education, how they can build coaching relationships and structure a coaching agreement, how they can actually conduct their coaching sessions, and then ultimately too, how they can evaluate coaching programs. All right, next up. So faculty development to help faculty be able to use technology and leverage it to really augment their instruction. So giving them instruction on learning management systems, how to use online collaboration tools, how to use multimedia effectively, and really how to optimize the visual presentation of their material, and then strategies for integrating AI, as we would all love to do. All right, so these last couple are going to talk a little bit more be a little bit more process oriented, and it's probably something that are best implemented at a higher level, so either the departmental or the institutional level. So these are ideas that you might want to bring to your vice chairs of faculty development or education or your associate deans. But number 7 is just faculty development that incorporates instructors from the arts. So think artists, actors, improv professionals. We all as faculty can learn a lot of tips in how to inspire our audience and connect with our audience, which is definitely something that today's learners are looking for. All right, we can also encourage the scholarship of teaching and learning through skills training, recognition, and reward. So by engaging in research on teaching and learning, our faculty can actually really understand why we do what we do, right? They can learn about best practices, they can contribute to the knowledge base that is in our field. And I think one of the things that learners expect is justification and a rationale for why we are giving them certain content and why we are doing it in the way that we are doing it. And if we equip our faculty and have them actually participate meaningfully in the scholarship at teaching and learning, we're actually equipping them to also be able to meet those needs of the learners. All right, number 9. So promoting a faculty development culture of continuous improvement. And there are a couple of different ways that you could do this with regular workshops, lunch and learn sections, really recognizing and rewarding faculty for putting an extra effort into their professional development. You can establish mentorship programs and peer learning communities, and just make this sort of part of the norm, part of your annual reviews, part of your goal setting with faculty. And that will ensure that they're continuously evolving and improving to meet the needs of our learners. And then my last strategy here is just making faculty development a priority within the institution. Again, this is going to be something that you're going to need leadership buy-in. So definitely talk with your Vice Dean of Education or your Associate Dean for Faculty Development. But these are some suggestions that you might bring to them, and just making faculty development an expectation and a norm for any course. Conducting needs assessment for faculty development. Developing strategic plans and goals related to faculty development at the institutional level. And then providing funding for specialized training with the expectation that those faculty would then gain that knowledge and bring it back and share it with their community. And then lastly, just providing adequate time and resources for our faculty to actually engage in these types of activities. And I'll turn it over to you.
So we've talked about a lot of different things so far, and I wanted to take a few minutes just to have everybody stop and reflect on what we've talked about and think about how we can apply some of those things into our everyday work. So I have an activity for you. You are tasked with revamping your course. So whether your course is something in the preclinical years, a clerkship, if you're APD and you're doing curriculum development for your resident lectures, whatever it is that you do. So you're going to first start by reviewing some recent course evaluations. And you're realizing that there's kind of a lack of engagement with both the teachers and the learners. And we talked a little bit about generational change and some of the things that that you think that you may be doing that's good for the learners, but the learners may not actually be receptive to it. So here are some examples of course evaluations that you may have seen or seen similar ones. I want to travel to my best friend's wedding across the country, but they won't give me time off from my rotation. Some of the attendings were distant and did not care about my presence during a shift. It would be really helpful if lecturers were either on Zoom or all asynchronous, so we don't have to travel to campus. I couldn't go to my doctor's appointment because I had to attend simulation. For those of you who read evaluations, do these look familiar? Have you ever seen things like this, or maybe worse, maybe better? All right. So, so the question is, can you take your course? Can we change our curriculum? Can we adjust it or restructure it some way to meet the stated objectives, learner objectives, while prioritizing the values and the needs, the wellness that we talked about? So I would like if you all take a couple minutes, talk to the people around you about whatever it is, what course you run or teach, and then discuss some strategies that we talked about today that you can apply to your course. And I have a few discussion topics to kind of help spark some discussion, but we'll take about 4 or 5 minutes just to talk to people around you and think about what we can do to achieve these things. All right. So it sounds like there's a lot of really interesting discussion going on. Um, sorry, that to interrupt, but I want to take this time to ask people if they want to share anything that you spoke about at your table in terms of strategies to apply or how you're addressing the newer generation of learners. Yes.
And is that a defined policy that they know about coming in? Or? Mhm.
Yes.
So for strategies that can motivate faculty to shift to a more learner-centered teaching model, so I'm an associate program director for my institution. And one of the things I recognize is that a lot of the faculty are very busy doing their own thing, and sometimes it's hard for them to learn kind of core educational principles. And I found it kind of easiest to make an educational intervention and incorporate something active learning, but providing them with everything that they already need so that they don't have to do anything extra or learn an additional skill. You're just facilitating the way that you, as the education expert, has designed it, but in their content area of expertise, for example.
And so is that for resident conferences?
That's for resident,
Uh-huh.
for resident
Okay.
conferences. Do the same thing with medical students.
Uh-huh. And how are faculty receiving that?
So one of the things that we also tied that to was EBUs and incentives for financial incentives through the department. And so, now folks get let's say payment for their, like if there's a bonus structure, they're eligible for that if they have a certain number of GME or UME activities that they participate in.
That's excellent. Yeah, it's always easier, I think, to get buy-in when you have some financial support. Yeah. Yes. Mhm. Are there other? Oh, go ahead.
No, I was just gonna just underscore that because there is a component of making the learner feel like this is high yield in order to get their buy-in. And so when you are offering these diverse strategies in educating them, and when they perceive it as being high yield, you get less pushback generally with negotiating whether or not they have to be there or not. I like that strategy.
Are there any other technology innovations that folks are using that you found successful? Do most people off? Oh, go ahead.
Well, I was just gonna say, we talked more in general. We talked about a couple of different things, and one of the things that I mentioned that we are currently in the process of doing is changing our all didactic sessions. So we had 4 hours where we were doing a lot of lecturing, and we're changing that to small recorded sessions on a variety of topics, and then we're changing it to have Jeopardy during our didactic sessions so that they get the knowledge from these little short, bursts because, I mean, even students are like us in emergency medicine, which need, fast and quick, and what do I need to know? And we're doing that, and then we're testing now on Jeopardy, and they see, and we've just tried it for the first time, they seem to really enjoy it. Another comment was, the third thing I mentioned to the group that I really struggle with that how can institutions encourage self-care and resilience while holding students to professional standards? Because I have teenagers and I have expectations for them that are not much different than my expectations for students. So if students fall short on what they were supposed to do, I really struggle because the mom in me comes out and says, what is wrong with you? You know, you were told to do this. Why didn't you do it? So I really struggle with that. And then I'm going to let Jennifer talk about what she was mentioning, because I really like this idea of not necessarily thinking everybody, like, we have to cater to a new generation necessarily. Because as I said, I hold everybody to that standard. So not necessarily cater to a new generation, but what Jennifer was saying I found very interesting. I still was actually the chairs and legislators with group 2 years ago, and it's a book called Intelligence, and a lot of you may have read it or seen it. It's great. It is a great book, and what I took out of it was basically that, you know, instead of focusing on this generation does this and these people are lazy and they don't pay attention or whatever, we look at all generations and what strengths do they bring to the table and how can we incorporate that? How can we kind of hold on to that and bring people along and take those strengths and collaboratively move forward, and find value in all the generations that they bring to the table. So it's kind of a really fun thing. So it's a good read.
Any other innovations or any other discussion topics? All right. I think this is actually really interesting to hear what other folks are doing. I like you. So you mentioned that you're giving them the didactics asynchronously and having them come in. I feel like with a lot of the learners that I'm working with, they are unhappy with the death by PowerPoint lectures that we always talk about. They want to come in, they want to be engaged. So if they can learn outside and then come in, and you can really utilize your sessions to be hands-on, to apply their knowledge and skills. It's really helpful for the learner to feel like they're getting more out of it. And that engagement, also the ability to interact with students more or your learners more than just sitting there and giving the lecture, is I think really important, because it also helps you learn a little bit more about them. And sometimes I think we have students or learners who have a lot going on. Maybe they are burning out, or they maybe have things happening at home that is causing their performance to suffer. And so being able just to engage with them and get to know them a little bit better is very helpful in terms of the wellness aspect of their learning. Good. All right. Anybody have any last minute comments? Final comments? All right. Well, thank you all for coming. I appreciate it. Enjoy the rest of your day.